Hello, I'm so pleased to meet with you virtually. This session, we're going to discuss local global nurse leadership. I'm Dr. Michelle Acorn, and I'm the International Council of Nurses Chief Nurse. And I'm just thrilled to connect with you all at the University of Sheffield, Doncaster, and Bassettlaw Teaching Hospital. And special shout out and thank you to Professor Parveen Ali for the kind invitation. I so wish I could be there with you in person. And as you know, Professor Ali is also editor-in-chief for our International Nursing Review. So let's get down to it. The International Council of Nurses is a federation of more than 130 national nurses associations around the world. And it was founded in 1899 as the first non-governmental organization recognized by the World Health Assembly, an organization rather. It's the voice of more than almost 28 million nurses worldwide, and we're the first and the widest reaching international organization for health professionals. This is an important day. It's International Nurses Day, and the 2022 theme is Nurses, a Voice to Lead, Invest in Nursing, Respecting Rights to Secure Global Health. And we want to celebrate with you around the world on the anniversary of Florence Nightingale's birth. And thank you so much for your value-added contributions. It's beyond words. It's really showing what we contribute for nursing and global health around the world. Thank you so much. Let's actually take you through IND themes, the building blocks for improving population health as well. And it's really going back to the foundation of what sustainable from the United Nations, for example. There's other key resource documents that I encourage you to review, even at a high level for the executive summary. There's the World Health Organization State of the World Nursing Report, where it dives deep into country level details. Next, look at the WHO Strategic Directions for Nursing and Midwifery and the 4-year plan that hones in on education, leadership, service delivery, and jobs, or I like to call it careers for nursing as well. If you have not already looked at the ICNM's Sustain and Retain Report on Health Workforce for 2022 and beyond, it's a pivotal sentinel document that will help inform our direction. And of course, hot off the press, going to be formally launched on May the 12th, is our IND report. So let's take you through some significant contributions and rationale and direction that we need strategically. Our toolkit actually aligns these key documents that I mentioned before: the Strategic Directions for Nursing Midwifery, the State of the World Nursing Report, which is the first of its kind, and the International Center for Nurse Migration Sustain and Retain Report. If you're referencing any of these in your documents, or more importantly, to really align with your mandates, the mission, vision, and the strategy moving forward to advance progress for nursing and for the world. The toolkit specifically focuses on 4 policy areas: education, and service delivery. And we'll go through some good examples of why it's important to invest, advance, and monitor for data, dialogue, decisions, and relevance as well. But ICN has specifically added 2 extra strategic pillars and priorities that have come to the front over the last years, especially pre-pandemic, but as we actually address response, recovery, and rebuilding for a better world beyond COVID as well. The 2 pillars we specifically are looking at are the safety of nurses and the health and well-being of nurses as well. This is a defining moment for us. We are all living the workforce challenges with heavy loads of work over sustained long periods of time. The complexity and demands of our care as we pivot and flex, and the under-resourcing and investments in healthcare and our social systems as well. We need to think about advances in healthcare with a rapid explosion of technology and medical science. The digital technology outreach and innovations in data analytics or machine learning, as well as exploding across the world. And we also have consumer expectations changing for informed and empowered, evidence-informed population health as well. We all know the global challenges. We have the pandemic that we're living through. We've had endemics, we've had chronic disease optimization, and economic hardships as well. Why are we here? It's the power of nursing, how we are leaders on the front line, leaders in the boardroom. We're leading innovative models of care. We are a scientific profession. It's the art and science of nursing as well. Always evidence informed and evolving over time with best practices. And we adapt to meet the needs of our world health as well. So the first pillar I highlighted to you was about investing in nursing education. Why do we do this? What is the evidence? Well, we know that 73% of countries had disrupted education for our professionals. Another 80% had disrupted clinical placements, which really impacts on competence, confidence, and practice-ready nurses as well. Another 50% of countries report delay in graduation, which impacts our health workforce ability to respond. Why do we invest in nursing? The benefits are clear. We need to ensure that we have an increase in country domestic supply of nurses. Why? It's better health outcomes for patients and safety as well. You can see the career progression opportunities. With increasing career laddering and education, career progression is more likely even into the advanced practice nursing, such as clinical nurses and nurse practitioners. And we need to remember about it's not just recruitment, but it's retention of the valued nursing workforce, and more importantly, the contribution of their knowledge and the talent pool as well. The second pillar is important to invest in jobs. We know there's a global nursing shortage. We're 6 million actually short in 2020 right now. You can see by 2030, which is 10 years away, the forecast is for 13 million nurses short. And this is actually just a cascading effect of some PTSD, burnout and stress, heavy workloads, under-resourcing, and as well as professional practice barriers if you're not enabled or fully empowered to work to your top of your scope, as well as giving you and supplying you with the resources that are necessary to make a significant impact for health and safety as well, and meaningful valued professional contributions that can sustain the test of time and challenges as well. You will see that thousands of lives could have been saved with adequate levels of staffing and skill mix. Nurses, interprofessional teams with midwives as well. Over 1 in 5 countries report an increased number of nurses leaving the profession, and it's been headlines, intent to leave. Studies are looking at leaving the profession, but I'd like to challenge you, and I have a mantra right now about my intent to lead, to stay, to invest, to work together collectively to improve the situation at hand for the profession and more importantly for the populations we serve. 90% of countries surveyed report that they're extremely concerned for nurses' workloads, stress, mental health, well-being as well. And another 80% report they're overskilled for the roles they're performing. We have the talent, the expertise, the knowledge, skill, and judgment, and they're not being utilized to their full extent as well, which can be very devaluing for the profession. So what are the benefits of investing in nursing? Well, you can see that we highlighted 5 of them specifically, but meeting the challenging health needs and rising expectations of patients as we innovate in low, middle, and income countries, we need to be responsive as well. And of course, we have had other humanitarian crises on top of COVID. We need to ensure a sufficient number and proper skill mix of nurses across sectors and countries, and the diversity of ranges and roles that we're able to provide. The WHO estimates a return on investment to be 9 to 1. If you invest in nursing, invest in health. It's not a cost, it's actually a cost savings in the long run. You will see improved access to healthcare and making greater use of innovative and healthcare service delivery models as well. And lastly, improved satisfaction and morale of our nurses, leading to improved public interest, recruitment and retention in the workforce as well. You will see why we invest in the third pillar of leadership. We know women form 70% of the global health workforce, but are only in 25% of formal government leadership positions or organizational leadership positions as well. In the State of the World Nursing Report I highlighted earlier, right now, 67% of countries report having a government chief nursing officer, but they may not have the positional power, the authority power, or the resources to be able to have it fit for purpose. 1 in 4 of our national nursing associations the senior nurse leaders have not been involved in high-level decision-making like pandemic committee planning, for vaccination rollout, testing, infection control practices as well. And another 2 in 5 of our NNAs report specialized nurses in infection prevention and control have not been involved in establishing policies. Nurses are at the front line, they're behind the lines actually showing leadership, helping to educate, teaching at universities. They need to be involved in all levels of leadership policy as well. And they have the experience, the expertise, the credibility, and the legitimacy to be able to inform. I love this quote. How can people deliver compassionate care if they're cared for? We need to care for a profession. ICN cares for the nursing world. We're the visible voice and vital for nurses as well. And we need to ensure that we're investing in nurses for the delivery and service capacity as well. What does evidence look like when you underinvest in nursing service delivery? Well, we talked earlier, 80% of nurses are overskilled for the roles that they're performing. If they're not performing to the top of their scope, we're not getting the true value-added contributions that nursing can offer to us. There are inadequate staffing levels for safe staffing considerations and optimizing skill mix of registered nurses, for example, of advanced practice nurses, utilizing everybody to their safe scope of practice. We need to think about funding models that are inappropriate and not fit for purpose for sustained integrated options for nursing in the future as well. Excuse me, thank you. Lastly are the professional barriers. Excuse me. We need to think about not just the challenges and barriers, but artificial barriers that are enacted or enforced by legislation, regulation, governments, other professionals as well. There's enough work for everybody to enable and support full scope of practice across systems, thinking about local, provincial, national, and global considerations. We need to get out of the way or else help open the gates to support. There's enough work for everybody to make meaningful, impactful contributions. Let's think about the benefits as well of improved access to care for highly qualified professionals, utilizing skills and qualifications, not just task-oriented. Remember that care is cost-effective and efficient in health services for nursing delivery opportunities. And we know the high level of patient satisfaction, improved health outcomes, and public trust that aligns with nursing as well. We can improve access to healthcare and really innovate nurse-led service delivery models, health promotion, prevention, chronic disease optimization as well, and improve satisfaction and morale of nurses, leading to improved attraction, recruitment, and retention for our nursing health workforce. A very powerful picture here, but why do we invest in and care for the health and well-being of nurses? There is almost a 50% global average prevalence of mental health issues for nurses. You know how we have responded day in, day out, 24/7 a day, a week, a year. Nurses have experienced significant post-traumatic stress disorder, depression, and anxiety, more during the pandemic than ever before. We've had a lot of suffering, death, and dying, and trying to utilize available resources the best that we can. On top of that, there's been stigma and discrimination that nurses have experienced when we follow the ICN Code of Ethics and care for all. We need to think about investing in the safety of nurses, not just think, take forward action to reduce the risks that are faced by health workers and the long working hours, the physical labor, the psychological distress, fatigue, professional occupational burnout, stigma awareness, pathogen exposure, and limiting this from not just COVID, TB, infectious diseases, making sure we have adequate resources, and preventing physical and psychological violence for decent working conditions, safe working conditions, and being respected and valued as a profession as well. We know from the independent panel for pandemic preparedness and responses, the world was not prepared for the coronavirus disease. We knew this before. There was a report prior from SARS. Frontline workers also expose themselves to risk and put their lives on the line for fellow human beings at the cost to the profession, as well as they're trying to balance the demands of their own families, communities as well. We had over 180,000 COVID deaths of healthcare workers. This is a significant morbidity, mortality, and impact. 6 out of 10 of us actually had COVID infections as healthcare workers, even in the early days, let alone with the changes of mutations of the virus. 60-80% of us reported mental distress. Almost 50% of countries reported a significant increase in violence against nurses, and 5 to 20% of countries surveyed report issues with PPE in different healthcare settings as well. So you can see, we have studied this. Nurses are one of the top studied professionals as well, and you can see the evidence informed and the resilience of our workforce despite all of this. What are the key strategies for protecting our healthcare workers and nurses? Forefront is their psychological well-being. We need to ensure that we're fit for practice and we take care of others, and we need to take care of ourselves, invest in ourselves and our mental health, as well as our organizations, governance and the world. We need to provide that education and competency-based education and training. We need to ensure that we're adequately educated and equipped in our nursing workforce as well, and really focus on safe staffing levels to ensure the best safe outcome for patients as well as the profession as well. We investigate and publicly report on some of the systemic failures that have caused healthcare worker infections, for example, and mental health, and we continue to do that at ICN. We're collecting and reporting information about infections. We're trying to elevate and advocate minimum standards for infection control. And more importantly, maybe not more importantly, but what's paramount right now is recognizing contributions of nurses, which again, it's hard to do virtually, and the continued thank yous. It's beyond the bell ringing and the opportunities of giving coffee and chocolates and cake. It's the day in and the day out, authentic, meaningful recognition and sustained recognition by not just direct patient care, involvement in leadership opportunities, thanking a nurse in real time and thanking them for the long-term sustained time as well, and recognizing their contributions through sustained investment to maximize the investment long-term for the world health. You will see our IND report focuses, as I said, again, on 6 levers of education, jobs, leadership delivery, service delivery, prioritizing safety of nurses, and caring for the health and well-being of our nurses. So when you're using this to educate across your systems, there are great tools in here for you. So you'll find some practical guidance, actions for multiple stakeholders here that will take you through a detailed plan of care that you can actually make some commitments for. We've shared some in-country real-life exemplars from our nurse champions. Thank you so much for your contributions, by the way, as well. We've shared evidence-informed outcomes to ensure that we're monitoring and strategizing for investments, so we can ensure with government or organizational investments what this looks like. And we're supporting realization of the strategic goals throughout this toolkit for you as well. In terms of a good example would be the last one about protecting nurses and their health and well-being. Each of the strategies will address challenges, excuse me. We will be able to look at how you actually target nursing and nursing organizations to advocate for resources required to care and treat for our needs of our nurses and healthcare workers. There are tactics for public to show support for nurses. There are great recommendations for health service providers to invest in safe staffing levels and adequate resources for safe working environments and conditions. Their government policies and programs, for example, on occupational health and safety. And you will see some international organization for recruitment and retention and working conditions and safety as well. I won't go through this, but for your review at the back, you will see some action appendices in the toolkit for you about how you can help investing in nursing education, what nurses are able to do, nursing jobs. It lays it out beautifully. Investing in nursing leadership, investing in service delivery as well, investing in the safety of nurses, and lastly, in health being. You might want to come together as a community and practice locally and decide what your priority areas are. Pick maybe 1 or 2 or 3 of the top priorities to move forward, to educate, to advocate for, and to monitor the progress as well. On International Nurses Day, thank you on behalf of the International Council of Nurses. I thank you so much as the chief nurse. Please celebrate, take the time to reflect your valued contributions, and take care. I wish I could be with you soon, and save the date for the International Nursing Congress in Montreal in 2023. Hope to see you there. Take care and bye-bye.